Good afternoon. My name is Angela Smith. Currently, I am a graduate student at the University of Eastern Kentucky in the Psychiatric Mental Health Nurse Practitioner Program. The topic today that I would like to address is if there is a nursing attitude change when the patient has been identified as a substance user. I'd like to begin by stating how important nurses are in the forefront with providing care. The nursing profession has a long history and strong backbone that's related to the ethical and professional skill sets with providing care. In the nuances of today's healthcare, the patient satisfaction scores are greatly dependent on the care that nurses provide. According to Poor, Drummond, and Olson, patient satisfaction scores and outcomes are definitely tied to nursing care. What has been shown to be seen in literature, although limited, is how a nurse's attitude and or perception towards a patient does impact the health care that the patient receives. Often the change in the nurse's attitude has been related to the presenting of the disease or the disease symptom, not the patient. For example, thinking about that, a substance user comes in with maybe a cardiac issue that's maybe tied to or maybe not tied to having a substance abuse issue. However, the patient is looked at as an abuser, not as a patient, and therefore some of these unconscious negative attitudes are transferred onto patient care. Recent acknowledgement of how certain patient characteristics influence unconscious biases that can adversely affect the patient relationship. Hildegard Peplau was a strong theorist in recognizing the importance of the patient and the nurse relationship and its impact with the patient getting better. The literature that I used to examine the thought process was qualitative and phenomenological in design. I used the systematic, and all the literature that was read through also used a systematic design using databases such as PubMed and medical heading searching databases. Questionnaires and surveys were used as part of the data collection, and afterwards theoretical coding used to analyze data. All the literature that I evaluated and read through were level 5. After completion of reading all the literature, the common theme was noted that almost all specialty of nursing would benefit greatly from having more education and training with relating to taking care of patients with substance abuse disorders. Data also included how the unconscious really is not only hard to conceptualize, but it's hard to measure. And most individuals aren't even aware of what is prompting them to react or respond in the way that they're doing. It is known, and all the literature did support, that the nurse's attitude in the therapeutic process is really important to be cognizant of when dealing with and caring for patients. The interventions that can be included are more increased substance abuse related trainings, and trainings related to patients who have disrupted and challenging behaviors in all the clinical settings. I would also strongly encourage promote higher education. The literature did support nurses who had higher education reported more positive feelings towards challenging and difficult and substance abuse patients, and provide places for nurses to learn and recognize their own biases, to talk through them, so they can become more self-aware. And finally, the last thing is what place could benefit the most? What environment? All environments could benefit with more training related to substance users, especially since the onset, especially since 20 to 50% of all hospital patients have a comorbid substance abuse issue. Women's health, all the literature that I had gone through, women's health was definitely the one specialty that showed that needed more training, lacked the understanding of dealing with this population. Thank you, and have a great day.